It is the About Mansfield Economic Spotlight. Appreciate you being here today. I'm your host, Steve Casillo. And what do we do here? We feature people from CEOs to general managers to family-owned and even companies of one whose businesses have an economic impact here on the city of Mansfield, nicely wrapped up into a 10-minute nugget of information. And we want to thank the folks at the Mansfield Economic Development Corporation for sponsoring the Economic Spotlight. Today, we feature a local doctor whose business model is a little different than the standard way of doing business as a doctor. We bring in Dr. Darin Charles from Hometown Health. Welcome to the Economic Spotlight.
Yeah, thanks, Steve. Appreciate it.
Now let's get right into it. You have what's called a concierge style practice. Describe what that is.
Right. So, my practice is a concierge style practice. What's officially termed, I guess, direct primary care. And so, what that basically means is that we're a membership model practice. And so, rather than bill and collect everything from insurance like a normal practice would, we have a direct contract with each of our patients. So they pay for our services directly without sort of insurance getting in the middle. So I tell people it's like Netflix for family medicine. So you have a monthly or an annual membership, and then however much or little you use us, there's no additional fees for the times you use us, the things that we do here in the office. So it's sort of a fixed upfront membership agreement, and then it's kind of all you need from us during that period.
You have not been doing this practice since the beginning of your practice. You were knee deep in the insurance game. Why did you switch from, I guess, what is the standard way of doing medicine versus this, or at least the business of medicine?
Right. Yeah. So I've been in practice here in Mansfield since 2006. So coming up on my 18th anniversary of kind of practicing medicine here in town later this year. But I've just been in this practice for a little over 5 years now. So spent the majority of that time with a hospital system, Methodist here locally in Mansfield. Had a good practice, a booming practice. Certainly, I think a lot of people look for change because they're burned out or they just don't like the situation that they're in. That really wasn't the case for me. I really enjoyed what I did with Methodist, but was just looking to do something different. I'd always wanted to own my own practice, but owning a private practice in today's healthcare environment is really difficult to do. So the general movement is for individual private physicians to actually join bigger groups and hospital systems and those kind of things. And so this model was really the only option I felt that gave me an opportunity to jump into owning my own private solo practice. And so by cutting out the middlemen, by cutting out the insurance contracts, by cutting out all of the overhead associated with billing and collections and coding and all of those kind of things, we stripped it down to as ridiculously simple as we possibly could, and just a direct contract with our patients. And so we see folks, we take care of them, keep it as simple as possible.
Two-part question here. First of all, how did you come up with this idea, and do you see other doctors heading in your direction?
So I certainly didn't invent this. Direct primary care has been around probably for 15 years or so now. It's sort of growing in popularity, I think, both amongst physicians and patients. The patients really enjoy what we do here and these kind of practices, and so there's been a lot of growth in that area. So I had heard some friends of mine that I'd gone to residency with that were doing this practice and had been successful. I didn't think there was anything like this in Mansfield or the surrounding areas at the time, so it seemed like a good opportunity. I had a good base of patients and people, specialists that I work with and those kind of things. So really was kind of rooted here already. So felt like I could do this and be successful. And so just decided to take the leap. I think other physicians are interested in doing what we're doing, but it's scary. It's a risk to get away from the system that everybody's used to. So patients and physicians alike are very used to and rooted in the commercial health insurance way of doing things. And so to move away from that, again, either as a patient to look at doing something new, or as a physician, there's a certain level, even if you're frustrated and burned out, there's a certain level of safety and comfort associated with keeping your practice the way it is. And so yes, it's growing, but it's still scary. It's still a very small percentage of practices that do things the way we do it here.
And this again called direct care provider.
Yeah. So
but it doesn't really change your style of medicine. You are a primary care physician, or what?
Yeah, so I'm a family physician. Yeah, so board certified family physician. So we do all the things that family doctors do. I don't deliver babies anymore. Did a little bit of that in residency, but haven't done that in a long time. But outside of that, we take care of newborns, anything outside of the hospital. We take care of kids and adolescents. We take care, obviously, of adults, and we take care of elderly patients as well. So we cover kind of all ages. I always tell people, we cover the first 2 layers of pretty much anything. So whatever problem or health condition you have, we can usually get a couple of layers deep. And if it's something that's beyond that scope, then really part of my job is knowing when the right time to get you referred to a specialist for a higher level of care would be. So yeah, we take care of kind of across the board. And what's really nice about family medicine is the family part, right? So you see, we have several multi-generational families as part of our practice. So we see the grandparents, we see the parents, we see the kids. And so to take care of people and understand that dynamic is really helpful, I think, a lot of times.
As the direct care provider, what if people are paying on a monthly basis, or I would assume they can pay one lump sum to do the annual membership. Right. But what if they have insurance, or maybe if they have a flex account or a health savings account?
Right. Yeah. So that's, I think, the most confusing part for people is, well, I have health insurance and you don't take insurance. So why would this, or how would this possibly work for me? That's probably the most common question we get. It's interesting when people call us to see if we're taking new patients, the very first question that 90% of those people ask is, do you take my insurance? Right? Because that's what people have come to know as far as how healthcare works.
Are you in my network?
That's right. Yeah. So that's the first question. Not like, are you a good doctor? Can you take good care of me? Do you actually care about your patients? Can I see you when I need to get seen? That's not the question people ask. People aren't as interested in that initially as, can I use my insurance? And so the answer to that question is, most of my patients have health insurance. We encourage people to have health insurance. I think health insurance is an important safety net for a lot of reasons for most people. So health insurance has a role. But since we don't bill or collect directly from health insurance, your health insurance status doesn't really matter as far as how we take care of you here in the clinic. So if you have health insurance, we treat you just the same as for folks who don't have health insurance. It really just changes referrals and things that we order outside of the practice. But so most of our patients have health insurance. Those who don't, we help kind of guide through the system. I think what scares people about healthcare is that it's a lot of smoke and mirrors. It's a lot of unknown amounts of money, for one, but other things that they don't understand. And so just to be able to help explain what the cash price of something would be and how to access certain parts of their care, that's a lot of what we do, help people navigate through the system. And so yes, we see lots of people with health insurance. We don't bill or collect for anything, though. That's the beauty of it. So an annual or a monthly membership, and then it's kind of all inclusive from there for the most part. For people who have health savings accounts or flex spend accounts, a lot of those accounts don't want monthly charges without some sort of evidence as to what you've been charging that to. Mm-hmm. But we practices like mine traditionally can use those funds for an annual membership, so we can charge sort of a one-time fee for kind of physical and labs and those kind of things that would cover any of the follow-ups and any of the extra care you would need throughout the year. And so we do use flex spend and health savings accounts for our annual memberships, but they don't like the monthly charges. They want to see what the itemized bills are. And again, the beauty of what we do here, we don't make itemized bills, right? So when you come see us, there's no charge for the visit. There's no super bill associated with the lab work that we do or the charges that we incur here in the office for routine testing or visits, those kind of things. So
because that's all included in the monthly or the annual membership.
That's right. Yeah. Nice. So there's no need to keep track of all of the details. Like I said, it's like Netflix, right? Like you don't have to pay for every movie that you watch or those kind of things, right? You just pay the monthly fee, and however often you use it, it's sort of all inclusive from there. And so we don't keep track of itemized bills and those kind of things. Another question we often get is, well, can I submit the charges from you to my insurance for reimbursement? But again, the beauty of what we do is in the simplicity of what we do. And so what strikes people as odd is when their first visit here, we're done in the clinic and the visit, and it's time for them to sort of quote unquote check out. It's just kind of a smile and a wave, and we'll see you next time, right? There's no real checkout process because it's all included. So,
if someone was interested in the simplicity of Hometown Health, how can they find out more information?
Yeah, so the website's probably the place that has the most information. So our website's just myhometownhealth.org. And so myhometownhealth.org is where you can find out a lot about how our practice works and pricing and those kind of things. Can always call the office and those kind of things. All that information is on our website. But just read up about it from there. Check us out. We've been, like I said, well received by the community over the last few years. What the biggest difference, to a practice like this really is not the payment model. Obviously, that's a big difference from a business standpoint. But what from a patient standpoint, what's really different is just access and communication. And so in doing this, so the amazing thing about this type of practice is that by keeping things so simple, by getting rid of all of the extra red tape and the extra overhead involved with running a normal clinic, that I can see roughly 20% of the patient volume that I was seeing in my old practice.
Wow.
And still be a physician and do what I need to do as a business that's successful. And so my previous practice, I had somewhere around 3,500 patients that would have called me their doctor when I was working in my old practice. And now it's around 600 patients, and that's kind of where we'll stick. And so by stripping all of that stuff away, we just give people direct access, easy communication. And that's what I think most people are looking for from a primary care doctor.
That is Dr. Darin Charles. He is with Hometown Health. And again, that's myhometownhealth.org. One of the many people who are contributing to the economic impact here in the city of Mansfield. And we appreciate your time. That's a 10-minute nugget of information. Dr. Darin Charles, appreciate you being on the Economic Spotlight.
Great. Thanks. Appreciate it.